Hello, you are watching the MA Clinic Module 1 course MA106 video training. Course 106 is our Medical Surgical Sepsis and Infection Control course. This is an introductory course into medical assisting, and although some people do find it a little slow and not too exciting, I really think that learning about microscopic organisms and learning how to prevent infection is quite interesting, and that's what this module does. So this module, you will be using the Kin's Medical Assisting Fundamentals book. We'll be in Chapter 28, Infection Control, Chapter 34, Assisting in Minor Surgery. We'll also be using the Syntax program in this module. The proficiencies that students will be completing will be performing hand hygiene, so that'll be washing their hands, removing contaminated gloves and discarding them in the biohazardous waste, sanitizing soiled instruments, wrapping instruments and supplies for sterilization in the autoclave, operating the autoclave, performing skin prep for surgery, performing a surgical hand scrub, preparing a sterile field for transfer forceps and pour a sterile solution into a sterile field, putting on sterile gloves, assisting with minor surgery, applying a sterile dressing, and removing sutures or surgical staples. Okay, so let's talk about the proficiencies a little bit. A lot of these proficiencies can be combined by having students practice them all at once. So for example, you can have your student set up a sterile field, so have them clean the tray, put the sterile field on. You can have them, while their sterile field is there, you can have them pop instruments onto the field. You can place a bowl or container on the edge of the field and have them pour a liquid onto the field. You can also have them open wrapped instruments. You can have them put on their sterile gloves and move things around on the field. So there's a few things that you can do to combine these and make time a little bit more your friend while you're marking students off for proficiencies. So try to be creative and think that way. Performing hand hygiene, they'll be washing their hands. We do not do a surgical scrub. We do not have the sinks at our campuses with the foot pedals. Although we do cover how to do a surgical scrub, it's important that your students know the difference. So you can talk about and have them practice how they would scrub from their fingertips down to their elbows, how they would turn the water on differently compared to a regular hand hygiene scrub. You can talk about the equipment that might be different that they would use, and then what procedures they might have to perform that would require them to have a surgical hand scrub compared to just a regular hand hygiene scrub. There's equipment in your classroom to help you with this. There's a germ glove. It has a oily liquid that students would put on their hands, rub onto their hands, and then practice washing it off of their hands. There is a ultraviolet light that you can use to see how well they've done. Students really seem to enjoy that a lot. There's also blow germ powder that you can use to show how germs spread throughout the classroom. That's a fun activity that students usually like. Students are going to practice putting on regular gloves and taking them off carefully so they don't contaminate themselves. And then you're going to spend some time talking about what goes in the biohazard waste container, what doesn't, what goes in the sharps container, what does not, and how expensive it is for doctors' offices to dispose of biohazard waste, and why it's very important for a medical assistant to use these containers properly. Students will be sanitizing soiled instruments. Obviously, we won't have bodily fluid soiled instruments. A lot of the work that you're going to be doing in this module is going to require for you to think creatively We do not use an actual instrument cleaner. You can put a drop of food coloring into a bowl to make it look kind of blue if you'd like, to give the students a sense that it's a little different than what they're used to. You will have containers that you can keep your instruments in, bring them up to the sink. There are scrub brushes for them to use. So while we're on the subject of the scrub brushes, there is a set of hand scrub brushes as well as a set of instrument scrub brushes. These are not disposable scrub brushes. These are used over and over. We sanitize them when we're done. We dry them and use them again. When they do look kind of raggedy and they do need to replace, we will replace them. But these are not to be replaced for every module. You do not throw them away when this module is over. Students will be learning the fan fold method of wrapping instruments. They are to do that together with you. I like to have my students wrap a variety of different size and shape instruments so they get the hang of how to do it properly. Have them tape them and then give them a little shake to make sure that nothing comes out. We do have an autoclave in each of the campuses. The autoclave is not a very large autoclave, and to make good use of your time for your initial use of the autoclave, it may be a good idea for you to, and this is what I like to do, I take the sterilization reel. They're the pouches that have plastic clear on one side and paper on the other. I have my students wrap a tongue depressor. They use that tongue depressor later in the module for their throat swabs. Have them wrap that and label it properly. I like this because you can also put in the sterilization indicator strip and the student can see it. You can put a group of these tongue depressors in the autoclave and run the autoclave through. I like to use like groups of 4 or 5. That's for the first demonstration, and then they are more than welcome to practice for their proficiency on how to use the autoclave on their own. So that's a good way to get them started off. We have the skin prep for surgery. We do not have the skin preparation iodine or the Providone pads. We don't have the Hibiclens. So again, this is going to be something where you're going to have to be a bit creative and help your students learn how to prep skin properly for surgery. This can be done without all those chemicals. Then we have preparing a sterile field. Again, easy to do. You have the sterile fields. Please explain to your students the difference between a drape and a fenestrated drape. And then they can practice using forceps and pouring solution onto a sterile field. For the practice, before the proficiency, they can rewrap their sterile field. I know it's not going to be sterile any longer, but they can pretend. They can rewrap it, reopen it, and practice putting the field down before their proficiency begins. Same with the sterile gloves. I'm going to hand them a pair of sterile gloves. They come in different sizes, so try to match them up best you can. Now keep in mind, these gloves are very, very expensive. They are not to be given out willy-nilly, no more than 2 per student. So I suggest you give them 1 to practice with. They can refold it, re-put it back into the package, and practice putting their gloves on and off until they're ready for their proficiency. They will be assisting in minor surgery. There are steps in the book that they can follow and practice with the Mayo trays. There is also the Syntax program we'll talk about in just a moment. Applying a sterile dressing, again, you can be creative with that. And then removing sutures. We only remove sutures. Sutures are purchased through their practice sutures through Pocket Nurse. So make sure that you're purchasing all of your equipment at least 2 weeks before the module begins. Sutures are then removed with a suture removal kit. Those are the scissors and the forceps. We do not provide students with staples, and we do not have staple removers. If you would like, you can go on to YouTube and see if you can find a video on the removal of staples to show your students. So many things that you can do with your students proficiency-wise in this module. Okay, so let's get to the SimTex. SimTex is a simulation program. The students are not required to have a special sign-on. This is a single sign-on, and just because they are students in this module gives them access to the SimTex program. They will have access to all of these SimTex procedures. This is introduced to students in the first day or so of the module to give them plenty of time to practice these. These should be practiced often throughout the course. These can be practiced at home as well. So if they have an internet connection, they can practice the SimTex procedures. They do not work so well on their phone. They're going to probably need to have a larger tablet or a computer to get the most out of the procedure practice. So have them get in here and have them practice these a lot. If they have time, they also may practice these in class. Later in the module, they will be required to take a test on these. If they are practicing these outside of the test time, they will have no problem passing the test easily. They will have to at least get an 80 on the test to get credit for these. So they're going to have to do them over and over and over again. They can also take the test over and over and over again. So encourage them to do this a lot. Okay. Again, here's a section for optional ICAs for you to use if you see fit. You do not have to use them. They're here if you want to. You can use them as graded extra assignments, or you can use them as activities and go over the answers. There are videos that correspond in the days to the lesson plan for you to use, as well as links of documents for you to use. So here are 2 tests already on day 3. So now we know these tests will be due on day 3 for these simulations. Important to get your students practicing at least these 2 right away. This course will, you know, here's a thought too. If you have a dental assisting program, they have an ultrasonic cleaner. Maybe you can work with a dental assistant instructor to show your students how to use an ultrasonic cleaner. That is a little extra something that not every campus may have available to them, but those of you who have dental programs, why not? I mean, it might be fun for your students to do that. Okay, and they will have a test. They have the medical, surgical, sepsis, and infection control test. So my suggestion to you is to read these chapters thoroughly, go over all of the assignments, look at all the row, be very, very prepared. Think in your mind how you are going to get these procedures done, if you can combine them, how you're going to combine them. If you have a very large class, work with your supervision to see if you can get some help. Maybe have a teacher's assistant come in so you can both knock out proficiencies a little quicker. Classroom management is the key in this module. So with that, I hope this video was helpful. If you have any questions, please ask your supervisor or contact me, and I'll be happy to do what I can to answer any of your questions. So with that, have a good rest of your day.